Yeah, good morning, everybody. Welcome. I know some folks will join us later as well, and we will also have participants and listeners who will watch this at a later time. So anyway, welcome to all of you. This is a side event of the Commission on for Social Development. That has been looking now for the last 1.5 weeks at inclusion and resilient recovery from COVID-19 for sustainable livelihoods, well-being, and dignity for all. So there are only a few more days to go in terms of the CSoC, as you know, the in-crowd is calling the 60th Commission for Social Development. And so far, I've heard a number of important and interesting presentations and discussions. And I'm really sure that today will not be any different. It has been an unprecedented last 2 years, at least, for sure for the high-income countries, as I think, many of us who are working in countries beyond, the high-income countries, that for the low and middle-income countries, they were already used to challenging situations before COVID-19, which is very unfortunate by itself. So, one of the reasons that in 2015 the Sustainable Development Goals were developed is because we need to make this world more sustainable and more equitable. So, yeah, in 2015 the world came up with 17 Sustainable Development Goals that are providing us with a comprehensive framework for a more sustainable and equitable world. So the progress, unfortunately, is going very slow. So there is a group of people in the world now that came together and what they concluded is one of the reasons, if not the most important reason, why this progress on these 17 sustainable goals is going slow, is that we need to pay more attention to our personal development. So they call for the need to reach our inner development goals, so that means we have to work on our capabilities, qualities, and skills. And those are all required for societal change. So then the question is, how were these capabilities, capacities, etc., affected by the pandemic? So I would like all of you, the listeners, as well as the speakers, the participants, to realize that this call for inner development goals are basically reminding us that every issue, every problem has 4 perspectives: an I perspective, so the me; the we perspective, so the community; as well as the it and the its perspective. And the latter two, refer to systems and processes. So if we are examining today's event, and I have to peek in my notes now, so we are looking at the COVID repercussions on the changing NGO landscape and discrimination. So I'm requesting all of you, and that's both for the listeners as well as the speakers, to keep those perspectives in mind. For example, our first speaker, Sunga Jong, will share the experiences of a B Corps company. Company is called Empowered, and what this company experienced in terms of collaboration and assistance to NGOs, but also try to pick up what she's saying about herself and about her team. So I'm really delighted with today's panel. I decided not to spend time to introduce himself, and you've seen those slides flipping with the different bios. And if that went too fast for you, I encourage you to check out the Eventbrite later on, because the bios are shared there as well. So, and maybe, my colleague Diana, who's helping me today, as well as my colleague Mary Kate, can put it in the chat where you can find the bios. So the panel, and we have 4 great speakers, they will share with us a wide range of experiences during and related with the pandemic, telling us about that COVID-19 had an effect on the NGO landscape. It challenged the community, people, capacities, responses, the collaboration, funding, as well as the resilience and mental health. So we are very fortunate with a mix of panelists. I'm also aware that you know, really a nice mix of people signed up. I don't know if they are here live, but they will listening later. For instance, the second secretary of the Cuban mission, Mr. Richard Tour, signed up, and I hope other colleagues of CWS and other NGOs as well. Before I hand over the microphone or the floor or this virtual space to the first speaker, I would like to quickly share with you the experience that my organization, CWS, had in terms of the response of the so-called HQ perspective. And when the pandemic started in the beginning of 2020, we quickly established a crisis management team that was interdisciplinary, was often timely, you know, was science and data driven. So that's how we made our decisions in close collaboration with the different segments of our organizations. And we came up with policies about remote working, you know, strategies, about mission critical work and what that meant, mask testing, etc. So we did really well. And I know that we really did well because we did a lot of surveys with our staff who gave us feedback about that. However, when the pandemic prolonged and got further, I think, and that's what we learned from another survey we did recently, we less and less kept really the local context and the field situations in mind, because the prevalence of the virus was not everywhere the same, and the access to masks and vaccines was different, you know, in the areas where we worked. So we found in the last survey that our response got too slow later on, very often, you know, more into the, more recently, we looked at the situation too much from an HQ US perspective. I'm more than willing to answer questions later on about this. But the reason that I'm sharing is that, you know, when we were talking about this pandemic, and the pandemic means that, you know, this is affecting the whole world, right? That that we were all in the same boat. But it is clear, I think, if you look at this and to today's stories, that we were not in the same boat. We might have been in the same storm, but definitely not in the same boat. Yeah, what I would like to share is I am from the Netherlands, and in my country, I think in the coming weeks, basically they've said, you know, the pandemic is over. So no social distancing is required, no mask, it's done. So I know, because, you know, CWS works all around the world, that this pandemic is not over. I mean, we only have to look at the Olympics, right? You see all the masks going on. So, and for me, it's kind of a flashback also when you know, around HIV/AIDS, when the treatment was discovered and rich countries had access to it, they also were not interested in dealing with it anymore because there was a medication for it. Well, until today, HIV/AIDS is still affecting, you know, thousands and thousands of people. So let us keep that in mind. You know, the other thing is remote working. In many countries where we work, people don't have access to internet. How can they work remotely? So I think some of those things you will realize when you listen to the different speakers that coming from different segments, from NGOs as well as private sector, but also from HQ as well as from, you know, regional and local levels. So without further ado, I would like to ask our first speaker, Sungajong, to take the floor. But before I do that, I need to thank her company Empowered for their willingness to be the co-sponsor of today's event. I'm really excited that, you know, an NGO like CWS is collaborating with a B Corp company like Empowered. So many thanks for that, Sunga. I would like to, last thing, is that really the last thing, I would ask all the listener speakers to wait with the questions typing in, but really concentrate on listening. I think we really, you know, as a world, we need to develop our listening skills in a better way. So try to do that exercise and then come up with your questions at the end the 4 presentations. So Sunga, please go ahead.
Thank you so much, Maurice. My name is Sunga. I'm the CEO and president of Empowered. I'm also the co-chair of the American Sustainable Business Network, which is the nation's largest network of impact investors, social entrepreneurs, and capacity builders focused on supporting each other and implementing policy changes on behalf of all of us with respect to climate, racial justice and equity, and many other important aspects of policy. At Empowered, we are a company that is a B Corp and a benefit corporation. So we're focused on more than just profit. And our primary line of products is our solar lights. We have a very unique business model whereby, we sell to traditional retailers all around the world, where consumers use our products for camping, hiking, and other outdoor adventures. But this unique business model also then allows us to tier our margin structure to be able to offer the exact same solar technology to those in areas of the country and the world that lack access to electricity. So to date, we've been able to affect 3.8 million lives and avert 2.4 million tons of carbon dioxide. And we're able to do that because we partner with NGOs, with governmental organizations, with consumers to be able to, again, bring our lights all around the world, 90 different countries, to those who may need them, either for capacity building or in the case of natural disasters. So as per the topic of today's discussion, it's been a few challenging years because with the pandemic, we found that, not only were our NGO partners not deploying internationally out of concern for their own employees, as well as some changes in funding cycles for many of our partners because the focus was on this public health crisis. Unfortunately, with that said, we found that many of our communities that we typically service were without, this important source of light, and also our products charge cell phones. So they provide a means of communicating. So for instance, last year, after the earthquake in Haiti, normally we would mobilize, we would reach out to our partners, be able to deploy lights and mobile charging devices. But we had so few partners who were traveling to Haiti, who had the funding to be able to bring our lights. So that was just one very concrete example. We did a couple of things differently in order to continue to provide our services. So one thing that we did was focus a little bit more on domestic efforts. Our lights are also useful for those who may be homeless or lack resources to be able to pay for electricity. So we worked with several organizations here in the US to be able to deploy our lights. For instance, there's a very young boy in Chicago. His name is Jaquil Jackson. He was actually recognized by Obama as being a young leader, and he makes blessing bags. So we were able to put our lights into the bags that were filled with other necessities to be able to provide, basic accommodations to the homeless population. So just wanted to kind of share some examples of how we work generally, but again, how we were impacted by the pandemic in terms of being able to service some of those communities that unfortunately were not as reachable during the pandemic. So I'm going to stop there because I know we have a full panel, but look forward to continuing this conversation and being available for questions at the end.
Thanks, Sunga. Yeah, and that was great. And so I'm looking forward to some questions from the audience to you. Ebrima, can I ask you to put on your camera and do your presentation, please? Ebrima is from the Gambia Red Cross, so he's the public health officer. Ebrima?
Thank you. Like my discussion point, as I introduced myself earlier, I'm Ibrahima S. Jabi, Gambia Red Cross Society. I'm the health officer. I was working with the Ministry of Health before coming to the Red Cross. That was some years back in 2011. And now I'm working with Gambia Red Cross Society since 2015 to date. So my work area is public health. And I know COVID-19 has affected the whole world, not only the Gambia. So Gambia, as a small country, which is solely relying on most of the international donors, if the whole world is affected, virtually Gambia is going to be in a serious problem. It's going to be serious. About my video, I think I have problem with my camera. So my discussion point is public health initiatives we are reviewed, we are received in the Gambia, and was the local authorities of in COVID-19 areas. So one is true. The government and the local government and the international body, they really chip in to help us in terms of COVID-19 support. But actually, the support doesn't go as we wish. Because as I mentioned earlier, COVID-19 has caused problem, and we received a lot of dead bodies in the health facilities. For those dead bodies, management was very difficult for the government, and they give the responsibility to the Red Cross. So Red Cross, thank God, we are trying to work, but we don't work alone. We work with other international donors like UNICEF, UN bodies, then the International Federation for Red Cross and the Red Crescent Movement. So we chip into them, and we talk to them, and they support us in terms of body bags, disinfectant, and so on. So, but actually, for the side of government, we don't receive much support. So this really affects us to execute our duties in COVID-19 operations. Other areas like this house, volunteer support, really help is very limited. So was economic crisis, because if Gambia, which is not economically strong, rely on international donors, they don't have much export, import or export duties. They don't have much in that one. So actually, when disease of COVID-19 nature comes in, which is affecting the whole world, actually Gambia is going to be in a serious problem, and that's affected very well. Now government is not supporting, and the international body is not supporting, because if government want to chip in to support us in terms of activities that we are implementing in the COVID-19 areas, then they will run into problems. The run the government, missions and so on. So actually, this really affects us, and we are not giving much attention, which make the Gambia to be one of the worst country in Africa to be hit by this pandemic. Because if you check our population, the population is just like 2.5 million, but our COVID-19 cases went up to around 20,000 cases. So 20,000 cases, close to 20,000 cases, and with the population of 2.5 million is actually affect us very well. And the death rates for the COVID-19 went up to around 400 cases. During our operation, this actually give us a serious problem. Now we were even running into problems of testing, to test the people who are already who are suspected of COVID and who are manifesting some signs and symptoms. Then it was a problem. So we now rely on signs and symptoms of those people, and we treat them based on those signs and symptoms. So if those people happen to die during the course of treatment, we treat them as COVID bodies. So this was the case that make our death rate to go very, very high. But thank God, now things are under control with the support of UNICEF. We were able to do mass vaccination to so many people, and the Red Cross volunteers also went into the field to talk to the population and observe non-pharmaceutical measures, because you don't have money to buy medicines and vaccines, but you can do the precautionary measures to prevent yourself from getting the infection. So with the support of our Red Cross volunteers and some community members, we are able to control the pandemic, and now it is well controlled. So currently we are planning to do another mass vaccination with the Ministry of Health, with support from the UNICEF and US Embassy. We have some vaccines, then we want to do the vaccination, mass vaccination, meaning going to house in the population to vaccinate them and prevent them from getting the infection. So if it doesn't affect them, then it will be okay for us to control it very well. So I think those are the few points that I wanted to talk about. Yes, but we don't receive any discrimination from government. The issue is the government don't have enough funding to support themselves. You know, that make them not to give us a good funding to support the population who is seriously been affected with COVID-19.
Thanks, Ebrima. I mean, it's hearing you. I mean, it's amazing, right? We all come from different countries and contexts, and you know that a country that is already has a lot of struggles, you know, COVID clearly made things so much more difficult. And so thanks for sharing. I mean, it's heartbreaking to hear also those stories about, you know, people who passed from COVID and you know, even the struggles to give the right support and I mean, both for the you know, family and the ones that stay behind, but also for you and your teams as caregivers and support. So hopefully you will have some discussions about it later on. Rodrigue, can I ask you to share you know, a few of your words from?
Yeah, thank you so much. Hi everybody, my name is Rodrigue Makelele. I am the Virginia refugee organizer with Church World Service and active in the youth community around here, but also overseas in Africa. So I think we all can agree on one thing: COVID has impacted us all, you know. But for those relying on services to get on their feet and starting building their new lives in the new community, the pandemic has had quite the effect. You know, refugees are vigorously screened for COVID-19 before even traveling to the United States, and they can't come if they test positive. So they're impacted by the pandemic in a different way, but having limited access to goods and services. So we try to ease that impact, but for a good part of the pandemic supply chain, you know, were disrupted. So jobs were lost. So there were a trickle-down effect that hit vulnerable groups the hardest. This manifests both in the ability of communities to sponsor and volunteers to give time and financial support, and also in just, you know, the goods and services not being readily available. But I should add that despite materials and health conditions, our communities never lacked the desire to help. They remained supportive and welcoming refugees, you know, to our community. If only, you know, we continue to do this. We know that for the past, for 4 years, of course, cuts to refugee resettlement has devastating impact on refugees who need resettlement protection for families awaiting reunification. So refugees in harm's way who have already been approved for admission but are not now stuck in limbo. This is not only impacted the people who we serve by separating families, not forcing the vulnerable to remain in danger overseas, but it also weakened our capacity to welcome refugees since. So this was compounded by the pandemic. And as you know, some new arrivals were caught at the height of the pandemic when the country was shut down. They faced even more challenges than those who were resettled before them. And we often say, if we want to resettle more refugee, then we need to resettle more refugee, which sounds ridiculous, but it makes sense when it comes to building capacity. The only way we can welcome more displaced people in the future is to start welcoming more now, right? So because we can't wait, we are needed no matter what administration or pandemic. So how does that play out on the ground? Well, our staff has the experience to welcome, refugees. We just need the resources and infrastructure to do so. And sadly, that can't be rebuilt overnight. But in the meantime, refugees are feeling the effects and are all involved want the relief. So before doing the work as a community organizer, I was a case manager. And I know case management is a very crucial activity in the refugee resettlement world. So as a former case manager, I had experienced high-level care need by refugees when they first arrived in the United States, which went from making a phone call to service providers, to language, to trust, and so forth. And the first few months after resettlement is an extremely important and fragile time in the life of a refugee, as it determines how likely they are fully acclimated to the American culture. So COVID-19 pandemic halted the resettlement agencies from providing adequate services and support to the refugee family, increasing their likelihood of integration into American society. So the first person that built connection with the refugees when they get here is a caseworker who appears to be like the face of the United States. But because of the pandemic again, most of these activities were conducted remotely, except things that are impossible to be done remotely, such as like housing orientation for someone who comes from overseas, who has to learn more about the system here in the housing system. They had to have an in-person orientation so that I can show them what is to be done. There are first and second home visits that have to be done to make sure that people are living in their house and they're getting everything they need. They are warm enough if they come in the winter. But doing this remotely means prolonging the uncertainty that refugees come with to the United States. So they need someone to talk to, constantly ask questions, to share their concerns with, rely on advice and so forth. And when the work is done remotely, refugees start feeling that they have been abandoned on their own. I remember a refugee telling me that since we came here, got a job, we haven't seen you, looks like you abandoned us. It's just that they still feel like a physical presence of their caseworker or someone that they first knew was important, but it's not always possible. With the pandemic, we saw how things changed quickly. We wanted to make sure that we not only provide a service, but we also provide safety to the people that we serve. And that is not easy. That has been very, very, very challenging for many of us who wanted to continue to provide the work that is needed, the services that are needed for people to integrate the refugee community, to integrate here fully. And if I move that to advocacy or community organizing, it becomes again very complicated. And as an organizer, my work is really building relationship between policymakers and community members, including refugees, employers of refugees, faith communities, and other supporters, creating opportunity to educate policymakers and the public about the importance of refugee resettlement, and also registering voters, helping them understand their civic engagement journey within the United States. So it's challenging if we can have these one-on-one relationship meetings, conversations, then it becomes difficult even to engage, even with policy, makers, or just within refugee leaders. So yeah, I'm gonna pause there for now. Thank you.
Thank you so much, Rodrigue. First of all, thank you for sharing also that story of the refugee experience. Going back to what I tried to mention in the beginning, we identified these 17 sustainable development goals as a world that's necessary to make this world better. What is also clear is that people on the move that many of you are working with, they are often forgotten, in the policies and the plans of the different countries. So, and then, the COVID situation have further aggravated that. So they definitely are part of the most vulnerable. And if you talk about vulnerability, Blanca is going to share with maybe the most vulnerable under that, and those are children, and especially the children that are unaccompanied. So Blanca, please go ahead.
Thank you so much. Hello, everyone. It is an honor to be here, to be part of this panel. So I am a home study and post-release services regional supervisor at CWS. And it is a great honor for me to be able to represent my children's services team in my organization. And most importantly, I feel very privileged to be able to elevate the voices of unaccompanied children here today. So I will be talking from my perspective as a home study and post-release services provider. First, I would like to give some context as to who unaccompanied children are. According to the US Department of Health and Human Services, an unaccompanied child is someone who has no lawful immigration status in the US, who is under the age of 18, has no parent or legal guardian in the US, or no parent or legal guardian available to provide immediate care and physical custody. To give you some idea, since 2013, US authorities along the southern border have taken over 600,000 unaccompanied children into custody. We've had three major waves. One was in 2014. We saw 72,000 minors enter and get apprehended in the border. In 2019, we saw 80,000 minors. And as of October of 2021, which is the last numbers that we have, we saw 147,000 minors. Some other important factors. In the fiscal year 2020, 72% of all unaccompanied children referred to the Office for Refugee Resettlement were over the age of 14. 60% were boys. And the countries of origin were 46 Guatemalan, El Salvador 14%, and 25% Hondurans, and 8% others. So as you can see, the majority of these children come from Central America. So what is driving this massive exodus from Central America? I can tell you that US interventionism, including free trade policies that have created failed neoliberal economic policies, climate change that creates floods, droughts, hurricanes. Central America has a large section that is called the dry corridor. And this has created widespread poverty with severe food shortages, and all of these causes, as we know, social violence and political unrest. So in terms of how the COVID-19 pandemic has impacted children in particular, a UN report published in April of 2020 grouped the impacts of the COVID-19 pandemic on children into 4 dimensions or categories. Number 1, falling into poverty. Number 2, survival and health, which reduce household incomes, forcing poor families to cut back on essential health and food expenses. Learning, closing of schools and virtual learning, and risks for child safety. So if we talk in particular about the impact of the COVID-19 pandemic for unaccompanied children, we can talk of a threefold situation. Number 1, the impact that it had in their home countries. So the pandemic definitely coupled with natural disasters like hurricanes and droughts. All the lockdown restrictions that led for people not being able to pursue the majority of available economic opportunities in home country, which were already limited to begin with. minimum government aid decreasing and ceasing or remittances, which we know family here in the US are often the main breadwinners for families back home. And threat of death or severe disease for caretakers, not so much for children. We know that COVID-19 does not affect children as badly as it affects adults. And this led to the collapsing of already deficient healthcare system. Then we see the effects of this upon arrival to the US for unaccompanied children. And we can talk about Title 42, Emergency Health Order, that was instituted by the previous administration in March of 2020, which basically banned all asylum seekers, all immigrants from entering the US. And this led to basically children, unaccompanied children, being returned to their home countries. Now, with the Biden administration beginning in 2021, there has been a partial enforcement of Title 22. And basically, it excludes unaccompanied children from entering in these emergency order, but not their parents, not adults. And so we've seen a massive surge in unaccompanied children's arrivals starting in 2022. And we know that that also has to do with parents knowing that they're not allowed to enter to seek asylum. They've had to send their children on their own. And then we see also, as a result of this massive surge in children arrivals, overcrowded and understaffed facilities, and emergency shelters not being suited for children. And the impact of that in children's emotional well-being and health. And then we have post-reunification, how the pandemic has affected unaccompanied minors who are released from ORR care and reunited with their families in the US. So we have definitely seen food and housing insecurity. A lot of these families have lost their jobs, have seen a reduction in their work hours, leading to food and housing insecurity. We have seen reduced access to emergency basic and supportive services, and the challenges of virtual schooling, that for a lot of our families, not only often they do not have access to internet, normally they do not have access to computers or tablets for schooling. It is, even if they have phones, that wouldn't be accessible for children, right? So I am gonna leave it there. Thank you so much.
Thank you so much, Blanca. So I would like those who are on the call now to type in their questions. In the meantime, I take the privilege to ask a question to all the four speakers. And that the question that I have is, knowing what you know now and what you've learned in the last 2 years, could you name one thing, a behavior or an action that you would do differently? Who would like to start? Blanca, you?
I think being able to lobby for greater access to resources for these families. There were a lot of government assistance programs that included vulnerable families in the US, like the stimulus checks, unemployment benefits, etc. But none of that was made available to these families. And in many respects, for official refugee populations, there have also been benefits. But those are not available to unaccompanied children and their families, even though they face pretty much the same characteristics and challenges of refugees. In fact, many scholars call them climate and economic refugees.
Great, thank you, Blanca. Sunga?
Yeah, so I'd like to add to something that Rodrigue, is that correct? Rodrigue mentioned. He said one thing that would be helpful would be to welcome refugees now, today, because when there was the public health crisis of the pandemic, it made this work additionally difficult. So I think I share that perspective. Again, you know, we work in the space of both development as well as emergency relief. And we found that when emergencies struck in various communities around the world, because climate change is real and these natural disasters are increasing in frequency, the world was unprepared to deal with both the natural disaster as well as the public health crisis. So what we're doing differently today is we're trying to pre-position the lights and mobile charging devices that we offer so that they're already available in parts of the world that are susceptible to natural disasters. This was not the first, you know, earthquake in Haiti. Puerto Rico has been affected numerous times by hurricanes. For the first time, I'm really proud. I think my partner, John, is on this presentation as well. He has worked with Amazon Disaster Relief to literally pre-position our products around the world so that if and when a natural disaster strikes, we're not rushing to be able to provide services to those who most need them during those critical times.
Great, thanks, Sunga. Ebrima, what would you do differently now?
Yes, what we don't do because the pandemic has caught us in surprisingly. You know, we don't know. We were hearing like the pandemic the outbreak was in China. So before it will come to the Gambia, you know, very far. You know, we were thinking now, no, this is far from us, far east, so it cannot reach us. So all of a sudden we see one case in the Gambia and one dead, and it goes like that. It goes like that, and we have thousands of cases. So what we will do now differently is to create the emergency funding, because funding was our major problem. Now when we create a disaster relief emergency funding, and anytime we have issues of this nature, natural disaster, or you know COVID-19 or any other disease that can cause epidemic or even pandemic in our sub-region, we will able to tackle it in a very easy way. So that's what we are doing right now. Emergency funding, emergency funding. Yeah, thank you.
Great, Ebrima. Rodrigue?
Yeah, thank you. I think one of the things that we did that was successful was to combat misinformation about COVID-19 by recording and disseminating videos from health professionals in various languages relevant to refugee diaspora in the United States. So the professionals in these videos identified with these the groups of immigrants and refugees, making them more trustworthy and also authoritative on the topic. So these videos address how to prevent getting COVID-19, how to stop transmission, and facts that rebunked conspiracy theories about the virus. Knowing now how effective these videos were, it will be one of the first things I will do to respond to a new pandemic, making sure that everybody's getting information at the right time in the right language and no one is being left behind.
That's a great point, Rodrigue. And I think, you know, in the evaluation from, you know, CWS from the headquarters perspective, that was also something that came up clearly. If you talk about, you know, sharing correct information about what the virus is about, that's something that need to be available from the get-go. Yes, English is maybe the main language within CWS, but we have many you know, partners as well as staff members where English is not the first language, and especially, you know, when we're learning about this virus, you know, sharing information in the right language is key. We have already a number of questions. I'm going to read them out loud. The first question is for Ebrima. How strong has the role of community leadership been for COVID response, Ebrima?
Yeah, the community leaders, they are so welcoming, you know, because Gambia, the way it's divided, we have villages and we have towns. So the communities that are remote villages, they have leaders of village leaders or community leaders. So those community leaders, we go down to their level and explain to them how the pandemic is and how the disease can transmit from one person to another. And the people who normally bring it may be people who are coming outside the community from other places. So movement of people from other places may bring the disease. So if they see people who are coming in and they don't know where they come from, they should welcome them, but they should try to minimize the risk of getting infections from them. So, and they were so welcome, so they will understand our language. They will also go out and disseminate the messages to their the community members. So that one, we don't have any big problem in those areas because Red Cross is an institution that have volunteers in every community, one can say. So we have over 20,000 Red Cross volunteers in the Gambia, a small country. So those volunteers will go out to the communities and sensitize them and talk to the village leaders and talk to the community leaders, and we don't have problem in that area. At the government also, the government, the leadership, the central government, they are also welcoming. Although they don't have, the government is not strong, but they are not in that denial of, COVID-19 is not a real COVID-19 kind of effect. So they accept it, and any message we give them, they always respect our view and they always respect our advice. So that helps us very well to control the spread of infection within the country. Yes, thank you.
Thanks, Ebrima. And the next question is for all of the speakers. Your thoughts about COVID's impact on mental health of vulnerable populations. And I would like to add to that question also is the mental health of you as a caregiver, and especially in relation to duty of care. So my question is not only for the, what you've seen around vulnerable populations, but also about yourself and your colleagues and your staff.
So I think it's definitely had a toll on the mental health of everyone. So I know more than half of our team has been affected. Many have lost close loved ones. I also had COVID very early on, and I actually thought that, I went to the emergency room and I didn't know if I would be leaving. So I think that we're going to be dealing with this for many years to come. I know my children, again, friends, family, colleagues, partners around the world, some of our NGO partners that, we were working with also fell susceptible to COVID, and several now have long-term forms of COVID. So I think that it will take some time to really disentangle the longer-term impacts. And I think it's just a time to reflect on, how critical health is, physical, mental health, and to rebuild these networks of community support, education, care. And I think that should be one of the focuses. And so even something like this panel and being able to talk about the impact in our respective areas of work is really helpful. So thank you, Maurice, for bringing us together.
Thank you, Sunga. Ebrima?
Yes, in terms of mental health and psychosocial effect, the pandemic really affect our people, even the volunteers who are working within the communities, because we don't know the disease that much. We don't have those sophisticated labs to go and do the testings to know how it is. So actually, we will not know the impact of the disease within the communities. We only know that people will die out of it. So that makes our people be seriously affected in terms of mental health and psychological effect. So, but as Red Cross, we have volunteers who are here, and me as a psychosocial support focal point, we train volunteers very well, because psychosocial support activities, it doesn't need those big specialized area. You can train volunteers and go out to talk to people and tell them that it is a sickness, it will affect us, but at least many of us will go through it, and we will be able to overcome it with time. So that brings some of their mental health issues and psychosocial psychological effects to be controlled at least. So it affects us, but we have people who will go out to talk to them and bring their mental psychosocial status to be okay. So that really helped us, and we were able to help so many people in terms of psychosocial support in the communities. So that really helped us.
Great, thank you. Blanca?
Yeah, so I will say that for the population that we serve, there has been a significant increase in isolation, virtual schooling, which has not necessarily been accessible, for example, for unaccompanied children in the US, and increased levels of uncertainty and stress, caregivers losing their jobs. All of that has coupled into creating some significant mental health concerns with unaccompanied children and their families. I can tell you that it has also in my personal life, or even serving this population, it has been difficult to, on the one hand, want to be able to go there and lay eyes on children and make sure that they're okay, and at the same time being concerned with their own well-being and that of our families. I have a young child, and I mean, up until today, I'm still scared of bringing her into public places because she's not yet vaccinated. So I think he's definitely take a toll on all of us and our mental health, but more so on people who already had huge struggles and vulnerabilities.
And I can chime in just for a second. I think the other aspect that continues to be challenging with COVID-19 that is affects many people, and people get stressed, especially those who have relatives and families behind that they're waiting them to come here, and then because of the pandemic they can't make the move, they can't travel. That was very challenging for many people to just be uncertain about when they can reunify with their family members because of the pandemic. The resettlement program was technically shut down and they couldn't have any arrivals. And those were even programmed to travel. You know, with the resettlement process, if your vaccination expire or all the examinations expire, then you have to go through the same process. And the stories that we hear from people, especially those in the refugee camps in Africa, when that happens, people are even sent back to, again, 5 years or more, just waiting to, again, be programmed to travel. So that is a lot of impact in people who are awaiting family reunification.
Yeah, you know, before I go to the next question, I would really thank you all for sharing that. I think what COVID made us realize is really that we need to pay attention to ourselves as well as to our colleagues, and that was often forgotten. Maybe before you know, COVID. I personally, I'm really helped by listening to stories and sharing stories, because I you know, then you feel that you're not alone. So creating that particular space, you know, and I know many of us are still working remotely and others are not, but even in a remote setting, trying to create this space, and I hope we're trying to do that you know, you feel that you're almost in the same room, right? And I think that's, at least that's helpful for me, to realize that we are in it together. And yes, we would like to make more impact in the world. We would like to ensure that we reach those 17 goals. They need to be reached before 2030. But we can't reach those without taking care of ourselves and as well, and of each other. So thank you very much for sharing that and you know, being vulnerable there. Rodrigue, the next question is for you. It says, it's from David. You talked about the problem associated with the lack of direct human contact due to the pandemic. Is this expected to change soon? So what is your take there?
Well, I think the only thing that would make it go away soon is the end of COVID-19 pandemic, and I hope that this is a one-time you know, crisis that we don't have to go back to. But also the other thing that eases the process of even people, again, having this in-person contact and talking and helping more our refugee, friends and communities, is by making sure that people are vaccinated enough. So for those who already had their vaccines, and visiting clients who also got their vaccines, I've started seeing more interaction, being cautious, wearing masks and social distancing, but at least people got to a point where they can again meet and have these very critical, services provided to refugees and immigrants. But there's been a lot of misinformation, as we said before, and also a lot of lack of trust. Many of the immigrant and refugee community didn't want to take the vaccines because I don't know if you guys were watching on social media and TV and everywhere. Everybody was bringing new information every day about COVID-19. It's gonna kill people. It's a chip that they're putting on. And for people, especially my fellow friends from the Congo, for example, there's a lot of religious biases around vaccines, the end times, and this is happening because that's how it's. So it was so chaotic that people didn't even want to take vaccines. Now we're seeing a lot of changes in people deciding to take vaccine. I think that is what is helping in the process of, everybody getting there, being more safer, so that we can continue to provide these services that are golden. It's life-saving services.
Great, thank you. The next question is for Sunga. It's from Mary Kate. I'm so impressed by the quality and multi-purpose nature of your products. Is there ever an issue of recipients selling products in exchange for some cash flow, or are recipients tracked and their use of the product is predominant for them?
Great question, thank you. So again, our business model is based upon selling at full retail in developed country markets. So we sell at REI, for instance, full retail. And then when we work in either emergency relief or in development, we tier our margins. So for our NGO partners, for anyone who is doing actual relief work or development work, we have a completely different margin structure. But here's the beauty of the program. We support the resale of our products. So for instance, female entrepreneur networks are one of the programs that we support in whatever country that they may exist in. So let's say our normal product sells for $20 here in the US. We may sell to a female entrepreneur network for $1 or so that they can then resell in their local communities and gain economic empowerment and also help their local communities with the source of light that is not kerosene or harmful firewood. And it really builds community and safety and provides for clean light for their children. And so that is actually the type of program we love when people resell. So, this whole business model of ours is really based upon, bringing quality products to people that fulfills a need. And the way that it works is really about partnerships. So partnerships with CWS, for instance, other NGOs who are actually deploying on the ground. And because this is the UN, I want to share that we were awarded by the UN for special recognition of our work in the area of partnerships, but we also work in the area of 10 of the UN SDG goals. So really pleased again to be here to talk about the ways public and private sector can work together.
Thanks, Sunga. And yes, the collaboration with, between CWS and Empowered has been around, the backpacks that my colleagues have put together and that are provided to people, well, especially children in need. So, and often, if they have cell phones, the problem is charging. So the lights who can also charge. Actually, I have one of them with me. I don't know if you can see it, but they're really cool. And we are looking at further collaborations. So thanks for sharing that, Sunga. I don't see any questions in the chat. So Amy, Amber, John, Richard, Angie, if you have questions, please type them in. Maybe I have a question to the panelists. Maybe you would like to ask your fellow panelists a question. So you know, raise your hands and go ahead. And because I do have some additional questions, but I don't want to dominate this discussion. So yes, Sunga, can you tell a little bit more about, you know, the duty of care and because you shared, you know, your team and yourself went through a lot of you know, hardship. And what I also heard is a lot of talk around preparedness, right? Be better prepared the next time. So can you share maybe any changes that you put in place so that this, what happened to you and your team and the organization as a whole, outside of pre-positioning the you know, the lights, but more for your team in a better way? Can you share that?
Yes. So one thing that we did was decide to become fully remote as an organization. So we will never be going back to an office. I think you heard me mention earlier that more than half of our employees contracted COVID and/or had dear family members also contracted. We're based here in New York City, so we are at the epicenter, you know, when COVID moved here to the US. And we realized that both for you know, sustainability reasons, like there's no reason why we should all be commuting into this office, as well as health reasons. You know, we made this decision 2 years ago, and since then there have been multiple iterations of COVID-19. And so we're glad that we didn't have, you know, our team members come back to the office and then go back home. And, you know, there's been so much disruption for those with children, myself included, you know, with schooling and all these questions that we're having to ask ourselves as people, as family, as community members. So that decision was really helpful for us because it also led to, you know, a better work-life balance for our team members. We now have team members that we've hired from all around the US. They're able to take off as much time. We're giving unlimited sick days if someone needs to take care of themselves or a family member. And we're also, this isn't directly related, but I think part of what we're trying to do as a B Corp, we give days off for volunteer work, we give days off for voting. There's so much that we can do as people who are part of organizations, and especially, you know, for us being at the leadership of a B Corp, to be able to support the well-being of our own team members who are doing this work to support larger communities. And it's important to kind of live the values that you're trying to espouse through your work. So I would say that was a very beneficial reflection on, you know, what it means to be a healthy, happy employee that we took into account, you know, because of COVID.
Great, thanks, Sunga. Rodrigue, Mary-Kate, is a question for you. What are some examples of worries or aggravations that the refugees you've worked with have shared?
Yeah, I think one of the biggest one is the late process or the way that the process are being very slow, you know. And I recall a community member here who've applied for like a green card, and it's been a long time. They've been out of, you know, their work permit expired. The green card hasn't been processed until now, and I had to go through, you know, different you know, congressional representatives to just try to even, you know, get some help to get that. And I think that is mostly because of the way that, you know, the process has been slower because of COVID-19, where cases are processed at a very, very short or low pace. That's one of the things. The other one is jobs. You know, people going to work with a lot of worries about contracting COVID-19. Many of them have contracted COVID-19, especially in the Harrisonburg-Rockingham area, where we have a lot of poultry plants where most of the refugee communities work. And so it hasn't been safe, but again, they're like, well, we have to provide for our families. We have to be able to pay for our bills and financial responsibilities. We have to go there and work. And we have to provide, of course, a service to our communities so that people can have food. Those are essential workers who, without whom we can't, we can't go by or survive. So they do a lot of good work, but they're putting a lot of their lives and families and children's lives in danger just to be able to provide services and goods for our communities.
Great, thanks, Rodrigo. Any last question before I try to wrap up our session? Amber, thanks. Okay, we have 2 minutes to do this. So much of making it in the COVID landscape relies on digital access and digital literacy to keep relationship going, information shared, and to know what our population's real-time needs are. Are you finding that most of the people you support face more obstacles in their daily lives because of these emerging dynamics?
There's a huge lack of access and also knowledge on how to use these technologies among the children and their families that we work with. There's also the limited access to other resources and the fact that virtual work is just not an option for unauthorized immigrants. They have to go to work in person. So this also leaves another issue with children often having to stay home with virtual learning by themselves, trying to figure out how to access their education and also not having enough supervision.
And I can say most of the refugee leaders that I work with here have demonstrated lack of skills in technology. We have virtual meetings, we have virtual advocacy, lobby meetings and advocacy, and organizing online. And it's been challenging even to convene people on Zoom or these other technologies, which is not very, very easy. So we've been struggling a lot with just getting people acclimated with the technology to continue the same things that we were doing in person.
Ebrima?
Yes, in terms of reaching out to our people, normally it's not a big problem. We reach out to them all the time, but we have some problems with the communications. Like now the world is, highly involved in technology. So you have messages that are coming up from different areas. So those messages, some of them, in our communities, people will believe in those messages, even if they are rumors, the rumors that are not actually correct. So the countering those rumors normally give us difficulties in terms of executing our duties and services for them, because they believe in the messages before our messages we reach them. So if we tell them the realities in COVID-19, they will also tell us, but we've seen this thing on Facebook, we've seen this thing on WhatsApp messages, audios and videos, so on, they are circulating everywhere. So those are the things that make our work a little difficult for us. But to reach them in their communities is always easy and not difficult, because we don't have those hard to reach communities in our country here. So it's easy. Thank you.
Thanks, Ibrahima. Sunga?
So interestingly, we face a slightly different kind of issue with respect to this. So some of the communities we work with are very isolated and very difficult to reach. I will give you an example. We work with some medical communities in North Korea, for instance, very, very difficult to reach. And with the pandemic, with the shutdown of the borders, there's also been a virtual shutdown in terms of communication and access to some of the, very vulnerable populations that we serve. So it has been interesting, because when you move things to a digital space versus a human space, things are tracked and monitored in a different sort of way. And so I'll just leave it loosely like that. I think, there was, Blanca spoke a little bit about, maybe if someone here is not authorized, it makes it a little bit more difficult to work. So we're seeing some of that as well, and just being able to reach the communities in the same way we were able to by, having people actually go to some of these communities. When that work stopped, unfortunately, there was definitely a communication gap.
Great, thank you, yeah, all of you, and as well as the our listeners, participants for the questions. We'll try to wrap it up very quickly because we are over time, and Diana's telling me we have to wrap up. So I knew from the beginning that we had a very ambitious agenda, and I do think that we what you all shared and what we discussed is really important. And I hope that it will provide our listeners and ourselves with more additional tools that we need to continue to work in this space and trying to make a difference. In the beginning I said every issue has a I, we, its perspective. What I've heard around the I, what is important is that we really continue to take good care of ourselves. So we are not a superman, superwoman. So listen to yourself, as well. Second, around we, as a community, we need to continue to support each other, to tell our stories, and to ensure that we speak out when that is necessary, or ensure that people we work with, we create a platform so that they can speak out for the needs that they have, and the not access, if there are problems in accessing the issues or the tools that they need to have a better life. Around processes and systems, it's clear we have created a world that is not sustainable. So we need to change our food systems. We need to change the way we take care of each other in terms of refugees and accessing, being able to find a new place to call home, because we can't live in the place where we are. Most people, if not all, don't leave the place because they think it's fun. It's because they are not able to survive where they are. So preparedness, I've heard. So that's definitely a systems issues. How do you prepare yourself better as a person, as well as in terms of the tools and the systems that you need? Listening is important, and making materials communicate in the right language. So that will help to decrease the divide that is there. One divide that we talked about is the digital divide, and that seems to be more necessary to do something about it than ever with working from home. I'm doing a podcast called Walk, Talk, Listen, and a question that I always ask is, which piece of music or song best embodies about who you are? And I was thinking about, my speakers and what I've heard, and the song, and I don't know if you can hear this when I'm sharing it, is somebody that I interviewed a while ago called Maya Azucena, and it's a song called Fearless. So I really like to thank you for what you've done, and see you next time. And don't hesitate to reach out to us for more information and continuing our dialogue. Thank you all.